Hello, night shift workers, night shift trekkers, night shift techs, and day shifts too. Anyway, this is Kem, your fellow sleep techs, back on the road again, and we'll talk about some of the skills as a sleep tech. I think it will be a series simply because there's quite a bit to talk about. I hope you can hear me better, because I am driving and it's a little shaky here in this California road, or I should say LA road. Some parts of California is definitely not the same as LA. On that note, let's talk about some of the skills as a sleep tech. Let's talk about oximetry today. So what do we need to know about oximetry, right? Pulse ox, SpO2. We use different jargons, different names, different acronyms to talk about this thing that we do in the sleep lab, where we monitor the patient's oxygen level or oxygenation. Do you know that when you put these things on their finger, it does make a difference with some of the patients, and for others it doesn't, whether you put on a pinky, the big toe, whatnot, right? Simply because some patients have an issue with circulation and some patients do not. So think about it, where some patients also might be cold. Okay, so two things we already talked about. Some patients will have a variety or a varying SpO2 or oxygenation based on their circulatory system, right? Let's say some patients have heart failure, or they're elderly and their hands are cold. So the placement is very, very important, right? What you want is to place the probe, the SpO2 probe or the oximeter, to a finger with the largest nail bed. Okay? Aside from the size of the nail bed, is also to make sure that their hands actually are warm and not cold. Because if their hands are cold, that means circulation is poor. And when you have poor circulation, you don't have the proper representation of their oxygen levels. Okay? Remember that when that infrared light shoots up on their finger, it just takes a sample of that area where the light is shining and takes a sample of how much oxygen do they really have. There's of course a technical and more clinical explanation to that, but let's keep things simple. Okay, so again, one, you have to make sure that you put it on the biggest possible nail bed on the hands. So typically I use the ring finger. And the reason why I do ring finger and not the middle finger or the thumb is because we often use those fingers, the middle and the thumb, for other purposes, knowingly and unknowingly. However, the ring finger, who uses the ring finger aside from maybe cleaning up their nose, right? Or putting in their wedding rings. So on that note, it's least used or least utilized finger, and yet it has a good sized nail bed. And so with that said, what have worked for me in the past is I put it on the ring finger, whether left or right. I usually ask them, what is your dominant hand? And they say, I'm a left-handed person, so I put it on the right. So you want that probe to be on a finger that is least used, and that they have a less chance of creating any artifacts. And the other thing, the other item that you need to consider is taping. Once you put the oximeter on, make sure you tape it right by the finger, and also I add another tape on the side of the hand where I put the wire. What happens is, if upon movement they tug on that oximeter wire, it won't pull directly on the probe. It will pull on that area where it's taped. And so you have an anchor, and then you have another supporting tape in order to not disrupt the reading, because that infrared light is always shooting to get samples of that patient's blood oxygenation levels. I hope that makes sense. I hope that helps you, even for just this one little thing that we do at night, which is one of the most important sensors in the entire sleep study, the oximeter, the oxygenation of the patient. Without the proper reading, the patient can be misdiagnosed. The patient can have a false study, or that you can even lose the study. Let's say you don't pay attention to the oximeter and you only have an hour worth of oximeter reading. What happens to the rest of the night? Is that study still valid? So that's a big problem, my friend. Make sure that the oximeter is stable. Make sure that the oximeter is reading correctly. And if the patient is cold, make sure you add additional blankets or cover that hand to have an appropriate or a better representation of their oxygen levels. On that note, this is Cam Paliajo, your sleep tech buddy. Have a good night shift or have a good shift. Ciao.